Hello, my name is Haley McMullen, and today I'm going to be covering biotechnology's aim at preventing Alzheimer's disease. So, just a quick introduction and an overview for everybody. Throughout the world, Alzheimer's disease is the leading cause of dementia. There are currently over 2,000 people a year dying from this disease, and over 6 million people currently suffering from this disease worldwide. Studies are being shown and conducted in both people and animals to show how certain diets are able to prevent Alzheimer's disease. Currently, there is no cure to Alzheimer's disease, but with the help of biotechnology, the future is looking really positive and hopeful to putting a stop to this disease as it is deadly and decays at the brain until the brain is no longer functioning and people are passing away due to Alzheimer's disease itself. So, just to back up on what Alzheimer's disease is, it's a disorder in the brain that prevents one from remembering things. So, it can even be the simplest task as shutting the fridge behind you. Those that suffer from Alzheimer's disease slowly get worse. The disease itself starts out pretty mellow, just maybe bigger things are forgotten here and there, not a huge deal, but as it progresses, it gets worse, and even the simplest tasks are unable to be completed. So, this impairs the cognitive and the functional abilities in somebody who suffers from Alzheimer's disease. So currently there is no cure to Alzheimer's disease, but it is able to be detected 35 years before a patient ever shows a sign. So getting a brain scan and by looking at the x-rays, biomakers and scientists and doctors are actually able to tell you if you carry the gene to have Alzheimer's disease or if your brain is starting to decay in the back, as that's where it starts. So Alzheimer's disease starts decaying in the back of your brain and slowly works its way forward. That's when you progressively get worse. So biotechnology is a reassuring tool to help cure this disease. As I said earlier, there is no current cure, but biomakers are working to find a cure to Alzheimer's disease. So they're hoping to use tools and activities on patients who have been tested positive for Alzheimer's disease by preventing or just prolonging the disease before it begins to decay somebody's entire brain and it's unstoppable and there's no option after that. But with the help of experts, the future is looking reassuring for those who suffer from the disease, those who are at risk of it, and those who show early signs of it. So right now, what seems to be the most beneficial for those who are showing early signs of Alzheimer's disease or those who suffer from the disease itself or carry the gene to suffer from it is the dietary method. So studies have shown that it's an important role. Our diet is an important role. I'm sorry, I worded that wrong. But our diet and what we feed our brain is an important role in our chances of getting Alzheimer's disease or those who suffer from it. It shows an important role of how quickly your disease will better or worsen. So by keeping a healthy brain, we need to feed it and fuel it with things that are healthy for it. And studies show that there is a correlation in reducing the risk of Alzheimer's disease simply by just what you eat and what you feed your body with. So biotechnology is used in this by supplementing, biomakers are wanting to supplement our brain with omega-3 as that's something that is crucial for our brain and it's crucial in Alzheimer's disease and preventing it, and it's something that we all lack. So the biomakers are looking for some way for us to get our supplement of omega-3 as it's a huge shortage in our consumption and it's crucial to help prevent Alzheimer's disease. Something that we really need to keep feeding our bodies with to prevent this disease is unsaturated fatty acids, as they're essential for our brain. Biomakers are aiming to supplement and give a rise to signaling lipids, which these are just binds to proteins, and they mediate the effect of the lipids on specific cellular responses, a response being Alzheimer's disease. So again, unsaturated fatty acids are essential for preventing and helping the risk of Alzheimer's disease. So, as I mentioned earlier, following a specific diet, such as these pillars in the slide that I have, biomakers are super hopeful that this will help prevent, prolong, and potentially stop the risk of Alzheimer's disease. So biomakers have emphasized that eating a diet that includes fruits, veggies, green leafies, nuts, fish, and salad dressings, it actually positively affects the risk of developing Alzheimer's disease. Right now, biotechnology is aiming and doing a lot of studies on drug treatment. So current biotechnology that's being used to treat Alzheimer's disease, it's not aimed at completely stopping the disease, but just taking healthy steps at preventing it and prolonging the spread and the decay throughout the brain, which causes the disease to worsen within somebody. So swift progress are in hopes to help this lead this disease in a positive direction, and it is being studied and experimented by biomakers that are using biotechnology. So the biomakers are looking to come up with the right drug, but they need it to happen at the right time with the right tools that will help stop this disease and wrangle it before it gets worse. While I was doing my studies, I actually found an article from a scientist that said it is predicted within the next 30 years, Alzheimer's disease and dementia will actually double to 14 million. And as I said earlier, it's about 6 million right now. So biomakers are working at creating a drug that is aimed at removing the abnormal protein in the brain that is hallmarking and starting the disease in the decay in the brain. So although biotechnology is looking hopeful with the problem that our world faces, the scientists that are working at it need to agree on what causes the disease and what starts it. And once they all come to they all agree on what the reason for Alzheimer's disease is, hopefully they can come to terms with what they need to do to stop the spread of it. So, like I said, currently biotech companies are just hoping to use the drugs that they've been using, which help pretty much just prolong the disease. But bio companies are still working at a drug that has the potential to start a journey that would help patients with Alzheimer's disease and hopefully stop the decay of the brain, making the disease non-life-threatening, not harmful. More so just keep the early signs before it gets worse and they're unable to make decisions for themselves and they're incognitive and all that. So in order to stop Alzheimer's disease, I think we need to identify the causes of it, because by determining specific pinpoints of what's causing Alzheimer's disease, scientists could have a better understanding at what therapeutic approach they need to use to solve the issue, excuse me, that's so worldwide and so deadly and impacts so many people. So dementia and Alzheimer's disease affects so many people in the world that scientists need to continue working and biomakers need to continue working at finding the pinpoint. Currently, I saw that there are European scientists that are working to identify the disease within the area of the brain that it directly impacts when it starts. So by doing that, they're hoping to determine the disease and pinpoint the areas that need to be stopped by creating a drug that pinpoint that specific area of the brain. So obviously this process is going to involve many trials, examinations, theories, and comparisons to come up with therapeutic solutions to slow down or better yet stop the disease as a whole. There are legal and ethical implications that come in with biotechnology when discussing Alzheimer's disease. A big thing is taking the rights away from somebody. So when somebody shows early signs of Alzheimer's disease or is tested positive, it is likely that the family or even the psychiatrist, they immediately want to take away the person's right to a driver's license or a concealed weapon. And going back into the ethical issues, this can actually cause people to go into depression. And worst case, people want to take their life as they think it would be better off to just end their life when they still remember some things before they get to the point where they're unable to make decisions for themselves, unable to do anything for themselves, and they have to have a worker or a helper, whether it's a family member, a nurse, with them 24/7. Another ethical issue is when a patient is at the doctor's office and they mention that they have slowly been forgetting things or can't remember everything, whether the doctor or the psychiatrist immediately tests them for Alzheimer's disease, what the next step is, without stepping on people's toes or making people upset, putting them into a depression by assuming that they have Alzheimer's disease without doing any tests, that kind of thing. So, and the huge thing, the biggest thing that caught my attention was the ethical issue was a false negative result, as that can be more harmful. So somebody that may show signs, they get tested and they're tested negative for Alzheimer's disease when they really do have it. That's a huge legal and ethical issue, as it can fall back on the lab and the scientists and the psychiatrists and the doctors who give them that false report. So, although biotechnology has advanced in Alzheimer's disease and has definitely prolonged the disease within certain patients, it is still one of the biggest struggles for scientists and biomakers to find a drug, a therapy, a cure, just some sort of end to this disease. So the future does look reassuring, and the scientists are going to continue to work for a solution to the disease, but as for now, there is no pinpointed cure to this deadly disease.